The triceps can relate to shoulder pain in a couple of ways. So usually there's a trigger or tender point along the inner portion of this muscle, usually about 2/3 the way down the elbow. You get the client to contract the tricep muscle by doing elbow extension, and then you could feel out for the borders of the muscle. Once you identify that inner border of the triceps, you can palpate along the area looking for tenderness or a trigger point. Once you identify a tender area, if there's any referral into the posterior shoulder, you can hold that point, do some nice circular massage, some friction back and forth, and you're just looking to ease off that area, and hopefully the referral pattern will reduce. Another great way to treat the triceps is to place the client's hand down on the table like so, which is going to stretch out the forearm muscle and the triceps. What you can do is lock in towards the elbow as they're in this position, and then you're just going to slowly stretch down the entirety of the muscle, especially if you've done that trigger point or tender point release. You want to lengthen out the tissue to make sure that referral into the posterior shoulder is not going to happen again. You can use your body weight to just slide down the muscle. See how I'm just allowing my body to slide down? It's very minimal effort on your body. This is going to be good for stretching both the elbow extenders and the forearm flexors, and stretching both at once increases full range reach behind the body, which is important for overhead athletes and manual workers.